So good afternoon, everyone. We are here to give you an update on COVID-19, the COVID-19 pandemic, and how it has forced us all to find new ways of living and working. So I have our health manager, Regina Thomas, here with me, and our general manager, Tracy Appel. So it won't be a very long update, so we just wanted to let you know what's happening in the province and in our community. So as you all know, that the numbers in our province have been rising and we don't know what the future looks like, and school will be starting in September, so I'll do a bit of an update on that. A couple of weeks ago I met with Mayor Jerry Thiessen, Manu Maddock, the superintendent of School District 91, Dr. Raquel Kling, medical health officer, and James Simpson, the Vandorf Hospital administrator. We spoke about some of the concerns that were coming in from members and citizens regarding the number of cases in BC and about the startup of school. So the Ministry of Education announced a gradual restart period for the week of September 8th to 11th, 2020, to allow extra time for schools to orient the students and staff on a new health and safety measures. So the students will start school on September the 10th. Starting September 8th, all staff will meet with their school's joint health and safety committee to receive instructions about how the update guidelines, co-development with the BC Centre for Disease Control and Provincial Health Officer will work in their schools. This is intended to allow time for educators and staff to adjust to their new routines. Final plans and for learning groups, review health and safety protocols, and confirm lesson plans that align with the new school processes. Students will return to public school for orientation by September 10th, and will be assigned to their class, find out who is in their learning group, practice their new routines, and familiarize themselves with how to safely move from class to outdoor and common areas of the school. If your child is riding a bus, they will have to wear a mask. So here we are, and it looks like the second wave of the coronavirus is here. We do not know what the fall will bring us, so we want to remind you to please take all precautions possible to keep yourself and your family safe. Keep your guard up and follow the rules and protocols put out by the BC health authorities. Please wash your hands. Keep 2 meters apart wherever possible, and if you don't have to be out and about, stay close to home. If you do have to travel, wear a mask when you are out in public and take all precautions to protect yourself and others. Stay close to your own family. If we continue to practice these procedures, we can stop the spread of the pandemic. But we all have to do our part. This will be the new norm. There has been many changes over the last 6 months, and I would have to say that for the most part, these changes are a good thing. It is keeping us safe. Our manager, Tracy, will update you on what we've been doing here at the band office. We know that there are many updates that need to be given to community, and we are working on that the way we know that we can, I guess. And this is for our band membership. Like, we know that there's a lot of updates, and we're trying to figure out how are we going to do this in a safe manner. We are planning our annual General Assembly. We don't have dates yet. We just have to figure out a way on getting our community members together. So when we come up with a plan, we will let you know as soon as possible. So now I'll just let our General Manager, Tracy, talk about what some of the staff are working on. Thank you.
Good afternoon. So the band office is currently open for full services Monday to Friday. Full safety glass has been installed in the lobby, and if you would like to see a department, we ask that you make an appointment first. Upon arrival for your appointment, reception will have you sanitize your hands, sign in, and take your temperature. Anyone with a temperature over 38 degrees will be asked to come back another day. We ask that you please come alone to your appointment, as we are keeping entry into the building limited, and in keeping with social distancing rules, our lobby is only large enough for one person at a time. If you are experiencing a fever, dry cough, or tiredness, please stay home. Staff are working incredibly hard to ensure that there are no disruptions to services. We are also in the process of planning the AGA, as it is important to get the information out to the community. With numbers of COVID-19 on the rise, unfortunately, the AGA will look differently this year. But we can promise you there is something in the works, and once final decisions have been made, we will let everyone know.
Thank you, Tracy. So we'll go to our health manager, Regina Thomas, for her update.
Thank you. Good day, Saik'uz. Thank you for tuning in to our update for the community. Northern Health is, I'd like to explain Northern Health. I have a little thing here. I don't know if you could see it. Is the entire purple. So when you are hearing the news talk about Northern Health is the entire northern part of BC in there in the purple. So Northern Health is a pretty vast area that they're speaking about, which again is divided into 3 areas. And those 3 areas are again divided into 4. We fall into the Saik'uz. So when they speak about numbers of Northern Health, it's the entire Northern Health of BC. So for today's numbers, for COVID-19, total cases are 128 with an active 13 cases. 123 were lab diagnosed. New cases since yesterday of 4:30 was 1. Currently admitted to ICU are 0. Currently hospitalized 0. Total hospitalized to date is 14. So out of the 128, 115 of those recovered. So 90% of the population that have been tested for COVID have recovered. We have 0 deaths in Northern Health. To date, we have no outbreaks in our region, which is a good thing, and I want to commend all our members for protecting yourself and protecting the ones that we love, especially our elders and our children, by doing your part. Like Priscilla and Tracy, we can all beat this by staying 6 feet apart. That social distancing is a must, and staying home if you're unwell, washing your hands, disinfecting hard surfaces that are frequently touched, such as tables, light fixtures, your cell phone, doorknobs especially, and to remember to be kind and stay caring through these troubled times. For other health news in the health center, September 4th and 29th, Dr. Douglas will be at the health center in person for people that need to see her. All staff in the health center are in, however, they're only taking phone appointments and porch visits. We will still be open for emergency. If you do come and it is an emergency, our staff will be in their PPE, their protective personal equipment, so they'll have the full donning the whole gear on, so don't be alarmed. The color codes that are handed out to the community members are working, and if you do need a color code, we ask that you phone the health center and one of the health staff will bring you the color codes. This has been a must so we know that our community members are safe, and I've heard a few community members using it. I drove by so-and-so's house and I know she's safe because I see the white in her window. So if you're needing a color code, please contact the health center and one of the staff will hand deliver it to you or hang it on your doorknob. There's also new policies at the health center as they are here. We will be taking your temperature. We'll ask risk assessment questions. There is an isolation room for one-on-ones if you do need to come into the health center to see one of the staff. We're asking that only patients come to the health center, so no visitors, no coming with auntie or uncle with their appointments. That's prohibited at this time during COVID. So we also have new additions to our staff. Donna is our new part-time wellness worker. She'll be in the health center Monday, Wednesday, and Fridays from 10 to 4. So community members have that option of seeing Peter or Donna. Myself, I will be in the office only on Tuesday, Wednesday, Thursday, starting September 7th, as I'll be returning to UNBC to finish my Bachelor of Arts with a major in First Nation Studies and a minor in Environmental Science, and I look forward to completing my degree, so I won't be there as much. Linda, the CHR, she's away on holidays, and Kathy Alexis is taking her place. So our health center staff now consists of the wellness workers, Peter and Donna, the CHR, Linda, the elder supervisor, homemaker, Kathy Alexis, health managers, myself, maternity leave cover, receptionist, patient travel is Vivian, Elders Coordinator Krista, Janitor is Vivian. The CSFS staff that also work at the health center, however, I'm not responsible to manage, are the home care Shannon, the nurses Eloisa and Kirsten, and the doctors Douglas and Aldred, and whichever doctors come to the health center. So in September, we're planning, or maybe it may be postponed, I'm not sure because of COVID. So the health center is planning a dinner with the doctors to get together in Saik'uz so we can start that reconciliation and relationship building with the doctors in Vanderhoof. It's a must need and here in our community. I'm looking forward to that. However, during this COVID pandemic, there's limited things that we can do. So look forward to that, and we'll be posting for that on Facebook or hopefully posters throughout the community. So the vote for the disengagement for CSFS has been completed, and we will remain with CSFS for the remainder of our agreement. As well, wellness schedules are being implemented, again keeping COVID regulations in place. So Peter and Donna will be implementing their schedules back in slowly, keeping in mind that there's only allowed 6 people in a place at one given time when it's a close encounter. So on Mondays, their men's group will be resuming. Keep your eyes peeled on Facebook or posters for that. As well, Talking Circle and AA on Tuesdays. The community workshops will be led by Peter and Donna on Thursdays. Sweat every third Friday. The next one is September 4th, keeping in mind all COVID regulations are kept in place. So if you're unwell, please do not attend any of the activities until you're well enough to do so. So the women's group and the elders calendar for September will be posted on Facebook. Keep your eyes open for that. Krista and Kathy are working on that. So no one's left behind. Again, things are a bit different here at the health center and on how we would operate and conduct our business and activities. So please be patient and kind with all staff, especially yourself. The optometrist will also be here again for those that missed it, August 31st to September 4th. They'll be here at the health center again, taking appointments. The last one was filled, so a lot of people couldn't come in, so that's open for August 31st and September 4th all day. Keeping in mind, we're asking patients come at their scheduled time, and if they're early, to wait in their vehicles, as the health center's waiting room is only allowed 1 person in there. So the glasses are now in, and Kathy will be distributing them to the community, or if you can, come to the health center to pick up your new glasses. And that's my update for the health center. Thank you all and have a great day.
Thank you so much, Regina. So I think I just want to just say a few little words here regarding being kind to one another. I think it's really important. You know, I think everybody's really trying to do their best. I know it's a really hard time mentally for a lot of our members, and especially our elders. Our children want to go back to school, and we just ask you, please really try to have an understanding that everybody's trying to do their part. You do your part, we're going to do our part, and and just keep safe. We want to thank you, and we just thanks for joining us today. And if you have any questions, call our office and talk to Tracy, myself, or Regina at the health center, and we'll try to get your questions answered. Thank you.
With that being said, Chris, I'm the mental health therapist at the health center. She is also taking phone appointments or porch visits if you're needing any kind of support as well. Peter and Donna are there, as well as First Nations Health Authority. They have the doctor on call. If you don't have a doctor, you're able to call First Nations Health Authority, and they'll set you up with a telephone appointment with the doctor, as well as a mental health therapist. There's a lot of support out there. Community, if you need anything within the health, or if you're struggling, just call the health center and talk to the receptionist or myself, and we will help you get the help that you need. There's a lot of support out there, and it can be overwhelming, especially during this COVID, the pandemic.
Thank you, Regina.
Yeah.
Well, thanks for joining us today, everyone. Stay safe and be kind to one another. Thank you.